So my name is Amber Reeves, and this is my capstone project to complete my bachelor's in nursing. So the topic that I chose to talk about, being that this is a urology clinic, you guys do a lot of Foley catheter insertion here. So I chose to look at test inflation of the Foley catheter balloon prior to insertion versus no test inflation of the indwelling catheter balloon. So during this presentation, my goal is to determine what the evidence-based practice is, not so much just what each person's been told. Because in speaking with a lot of different nurses and different staff that do the Foley catheters, I've found a lot of varying answers on does the balloon need to be test inflated? If so, why? If not, why? I've found a lot of different answers. Okay, so this is just a picture of a Foley catheter. I know you guys have seen many of these, but I just wanted to put this in here because knowing what the catheter looks like and why the balloon is so important is a big part of this presentation. Because if the balloon is not inflated correctly, if it's not deflated correctly, it can really cause a lot of trauma and harm to the patient. Okay, so like I said, when I first started thinking about the topic, I kind of had seen a couple of different nurses do their prep a couple of different ways. So I had one nurse who said she always tests the Foley catheter balloon because she wants to check for leaks, she wants to make sure the balloon is going to inflate correctly, all of that. Then I had another nurse who said that she never tested her Foley catheter balloons because she was taught that if you pre-test it, then it could decrease the integrity of the balloon, causing problems after insertion when you try to inflate it the second time. So that really got me thinking, you know, why do we have these two completely different ways of doing it, and what is the real evidence-based way that we should be approaching these? So like I said before, during this presentation, we're going to look at reasons that nurses do or do not pre-test the balloon. And then the evidence-based practice recommendation regarding whether that balloon does need to be pre-tested or not. So the goal of this presentation, like I said earlier, I just want to educate staff on what the actual evidence-based practice is, so that way we're providing the best care that we can to every patient that we come in contact with, whether it's here or elsewhere. Okay, so I already talked about this, but this is just my rationale for the project. Like I said, so I talked to some nurses, and what I found is a lot of the nurses that said that they always test the Foley balloon before insertion are nurses that have been in the field for a long time. So 10 years and greater are usually the ones that say they always test their balloon because that's what they were taught. Always test it, check for leaks, check to make sure that balloon inflates appropriately. The nurses that I found that don't always test their balloon and said that they don't because it could possibly decrease the integrity of the balloon are those younger nurses, newer nurses, less than 10 years is what I found. That's how they were taught. So it got me thinking, you know, why are there two completely different scopes that were taught? And I even had some instructors. I had some instructors during nursing school that were older nurses and said, always check your Foley balloon. I had other instructors that said, never check your Foley balloon. So what's the appropriate thing that we should be doing for our patients? So the difference in these techniques with different nurses in the same facility could cause a couple of different things. So first off, it could decrease the patient's confidence in the care that they're receiving. If they got one nurse saying it has to be done this way and they have another nurse saying it has to be done this way, then that could cause an issue with the confidence in that care. And then also, if an indwelling catheter is improperly inserted, or you know, the balloon is inflated and it's not supposed to be prior to insertion, and it causes that balloon to defect, or it's not checked and there's an issue with the balloon and then there's an issue after it's inserted, that could potentially cause trauma to the patient. It could place them at a higher risk for UTI. There's a lot of different things that it could do. Okay, so this is my PICO question. So in patients having an indwelling catheter placed, does pre-testing an indwelling catheter balloon decrease the integrity of the balloon? Or should all indwelling catheter balloons be pre-tested at the bedside to expose malfunctioning balloons or leaks? So this is just my base question for this presentation on what I'm trying to determine. So evidence for change, according to research that was completed by McDevitt and McDevitt, they said that it's not necessary to pre-test all indwelling catheter balloons because some of them are actually pre-tested by the manufacturer prior to sterilization. So if that balloon's already been tested, there's no need to retest it. Manufacturer already tested it. So in cases like that, you could potentially decrease the integrity of that balloon. But on the opposite side of that, there was another study that I found that said that pre-testing the indwelling catheter balloon is needed prior to insertion to check for those leaks or manufacturer defects. So even in the research, you find varying opinions on what is really needed. So what are the actual recommendations from the manufacturers? Since I was finding all this varying information in the research from nurses and clinical staff, I decided, let me look at the actual manufacturer and see what the manufacturer says. So DeVroyle is one manufacturer of Foley catheters. So I looked at their website and they actually recommend to test inflate all of their Foley catheters prior to insertion. The next one that I looked at is Bard, which is used here, and they actually have no recommendation. In their instructions, it says that the pre-test inflation is not needed, but it doesn't specifically say that you can't do it. So what I found from Bard is they do pre-test their balloons, but if you want to pre-test it prior to insertion, it's not going to harm anything. And then what I found from Medline, which is another manufacturer, is that they do not recommend pre-testing their balloons. So really what I found is it's really just dependent on the manufacturer of the Foley catheter balloon. So there's not all this way or all that way. It's really dependent on that manufacturer. So recommendations for change. So in all the research that I looked into, what I found is, like I was just saying, the best evidence-based practice for us to do is to look at that instruction manual from each catheter that we're placing. So if we're placing a Bard catheter, we need to look at that one. If we're placing Medline, we need to look at that one. And that way you know what the recommendation is from that manufacturer. Like I said, looking at the instruction, every Foley catheter kit should have an instruction packet in there already, and that will tell you step by step what to do, what's recommended. And then my proposal is to provide this education regarding the evidence-based practice instead of just what we were taught during nursing school, to follow each manufacturer's guidelines. And the best way that I thought would be to do this is in a verbal and a written way. That way, if someone's not available for the in-service, or if they had the in-service and they're like, oh, I don't really remember, if they have something printed, they have something to go back and look on. So okay, so during this course I won't have time to implement this project, but one of the ways that I would evaluate the project is before each in-service I would provide a quick simple survey. Do you pre-test your balloon? Why or why not? And then after the in-service, I would provide another survey, same thing, just to make sure that they understand what's being taught and the reasoning behind it, that it's not just a change just because, that it's a change to help us care for our patients better. And then what I would do after that is about a month after that, I would do another follow-up with them just to make sure that they retain that information. If they have any new questions or they ran into any new issues, seeing, is there anything else that we need to look into further? So the expected outcome of this project is to bring a new awareness and knowledge to the stakeholders that perform indwelling catheter insertions on the evidence-based practice recommendation regarding testing that balloon prior to insertion. This will help unify the staff on the topic so it's not so divided, I only do it this way or I only do it that way. It will help increase the patient's confidence in care because they are seeing that consistency. And then also it can help decrease possible patient complications and harm. So, if we're testing the balloon, but it's not supposed to be tested prior to, like I said earlier, it could potentially cause a problem with the patient. So in conclusion, the evidence-based recommendation that I found, like I said before, is just to make sure that you're looking at that manufacturer guideline for each Foley that you're placing. And this is going to be a difficult transition for a lot of nurses because a lot of nurses have done it one way for their entirety of their nursing career. So it will be a change, and some people have a harder time with change, but I think in the long run that it would be best for our patients and we would be providing the best care that we can for them. Anybody have any questions?
What do you do? Deflate? Or do you check?
I've done both.
See, I don't do
So prior to inserting the balloon, the syringe that has the solution in it to inflate the balloon, you attach it and you blow it up before.
I used to always
Most blow it up partially, not completely, but I have seen some that blow it up completely as well. So that's how you test it prior to.
Yeah. So I had already had put in the information.
And then you deflate it and then you insert it.
What'd you say?
So Amy said she's never not checked. So
I've always, because that's the way I was taught.
And see, I was taught to never check.
Oh.
I was taught that you're not supposed
How
to
long you been
inflate
a
the
nurse?
balloon.
23 years.
I've been a nurse for 20 years.
Yeah.
So you
I
check?
never,
check.
yeah, I always
We
check.
never
I
not
always check.
checked because it was drilled in us to
Oh,
check.
so you do. Oh, okay.
Anytime I go to insert a Foley, I always check the,
Oh.
because that was the fear that they instilled in me that
Right. That's it was like
what if you blow it up and it has a hole in it or it leaks or whatever?
Right.
You can't tell that, and
and I've had that happen where it did
Yeah.
when I blood inflated one time and the water just came out and that could have potentially been inside the patient. But I've already inserted that catheter. I was gonna have to remove and put another one in. But on the other side, based on the manufacturers, they do with their recommendations.
Okay. And these are my
Oh.
references.
Oh, okay.
Thank you very much.
Thank
Thank you.
Whew.